All right, we're continuing with feeding. The boobs, though, man, they're pretty amazing. With all the milk, the alveoli and just the whole system of milk production and let down and release. It's pretty cool. I actually look at the breast and the baby's mouth. I think that might be on the next picture, as the tree of life. So all the alveoli is like the branches of a tree, and then going into the mouth and into the baby's digestive system as the roots of the tree. It's really like the tree of life. I guess technically it'd be the other way around if it was truly giving life. But every time I see the tree of life, I think of a breastfeeding baby and a placenta too. I'm weird, I know. But there it is. Breastfeeding stimulates oxytocin letdown or release. All right, and like I mentioned before, oxytocin helps contract the uterus. It's pretty cool. Oxytocin is considered the love hormone. Outside of childbirth, oxytocin levels increase when, I think they even say there's oxytocin. I just read something about how dogs actually do love you. They actually have tested oxytocin levels on dogs, or something that it increases when they are looking at their masters, mistresses, their queens, if you will. Sure. Oxytocin is quite prevalent at the Hurlburt house. Anyways, colostrum, awesome stuff. Very low on volume, but very high in nutrients, very dense in nutrients. I think was it last week I was telling you how full mature milk actually switches over to colostrum again when their baby is born. So if a woman has been breastfeeding their older child through pregnancy, once the new baby is born, their breasts revert to colostrum. That to me says it's necessary and needed for a newborn, all right? Day 3 is when the mature milk starts coming in. All right, by day 5, they should be fully engorged and wondering what the heck hit them. Yeah. Breast milk does have a laxative effect, so most often new breastfed babies often poop like with every feeding, which is perfectly fine. If we're trying to get the baby to poop, say baby is jaundice, all right? Excessive bilirubin levels lead to the yellowish color of the skin, the jaundice color, all right? Bilirubin gets excreted out of the liver into the bowel, and it's in the bowel, it binds to the protein of either breast milk or formula, and then we poop, and the baby poops it out, all right? If there's nothing to bind to it, gets reabsorbed into the system and continues to add to the jaundice issue, all right? So you got a breastfed baby with this laxative effect. So we got more breast milk coming through and going out, and it actually helps with jaundice in that it gets it out of the system before it gets reabsorbed back in to cause more trouble. So that's good. Transitional milk it's like when they feel like their breasts are starting to fill. It's like when the milk is coming in, increases in volume. And then the mature milk present and accounted for within the first 2 weeks of life. Just like in pregnancy, passing the placenta, 1% of everything mom takes in medication-wise passes through breast milk. Everything passes through the breast milk. The issue is 1% of whatever it is going to be harmful to the baby. So it's not like some things don't pass through. It's just that they're not harmful. All right? So anyone who's breastfeeding needs to speak up. I'm breastfeeding. All right? If you're dealing with a woman of childbearing age, you need to ask them, are you breastfeeding? It's not just maternity. Pretty obvious. If they're my patient, that's a pretty standard question. But how about if you're working in a general practitioner's office or in the MRI suite? Because the dyes they use in certain radiological tests pass through breast milk. And we have to pump and dump, we say. After getting the injection of that dye, they have to pump their breast and get rid of like 1 feeding's worth of breast milk or more, depending on what it is. All right, so knowing the lactation status of your patients is really important because of this. And it's not just prescription medications, over-the-counter medications, supplements, different foods. I have never eaten broccoli again since my baby was like 3 weeks old. I never forget, I made this nice stir fry. I thought it was all that. You know what I'm saying? Well, apparently the broccoli was just too much. And that was the worst night of my young motherhood. I have not eaten broccoli since. The other day, she was eating broccoli. I'm like, oh, you like broccoli now? She's like, what are you talking about? Oh, I'll tell you, I gave you a terrible gas 26 years ago. Haven't eaten it since. I'm surprised you are. Sorry. I guess I just don't like broccoli. She didn't either, though, I'm telling you. You go through all these things. Other advantages, increased self-esteem unless it's not working out right? See where it can actually lead to decreased self-esteem? If you feel like you're supposed to know what you're doing and you don't, or you're supposed to enjoy it but you're not. And you can see where it can actually be quite the opposite of these advantages. Bonding, again, sure, great. Until you start resenting your baby because of the physical or emotional pain breastfeeding causing. So, you're pretty clear on my opinions on this whole thing? I am wholeheartedly in support of breastfeeding. But I am also wholeheartedly in support of the woman, the individual who is attempting to do so. Attempting to do the best for her and her baby. Again, remember, we have 2 patients. And in this case, we have to remember the mother. All right, yes, it is cheaper, no doubt about it. There's no preparation. I get it. Eventually, your baby, I always tell new moms, if you can breastfeed for the first 2 weeks, you can breastfeed for 2 years. And initially, it's not easy. And initially, you're both learning how to do this. Before you know it, your baby's going to be helping you unhook your bra to get in there. But in the meantime, and asking for it. Which at this point is probably time to stop. But when they start asking. But not really. I mean, a slightly older baby can definitely pretty much get in there on their own and take what they need. Yes, there's a lot of health benefits to it. Yeah, all of that. There's some disadvantages, sure. I mentioned the vaginal dryness last week, right? Yeah. Breastfeeding and sex don't really work for some people because of the hormones that lead to some vaginal dryness and whatnot for some. So a little store-bought lube, take care of that. Wish I'd known. Some women, we need to do the risk benefits of needed medications, all right? So sometimes there is mom needs a certain medication, say chemo, all right? Maybe she held off on chemo until after the baby was born, but she needs to address this particular cancer, all right? What's the risk benefit? The risk to baby is very high to breastfeed. But the benefits of mom getting the chemo outweigh the risk of not breastfeeding. You know what I'm saying? So bottle feed the baby, let mom get the chemo, and be alive for the baby later. That's just one certain thing. Other contraindications, certainly hepatitis B, an active herpes lesion on the breast would be another thing. Untreated TB, chicken pox. Certainly if mom is participating in any illegal or illicit drug use or likes to take to the bottle, Remember, 1% of anything she takes in gets to the baby's breast milk. So a 6-pack of beer is probably too much beer for a newborn baby. I have a cousin, his wife actually, breastfed both of her sons like for a full year. She did really well with that. And she did a lot of pumping and storing of breast milk so that I don't think they ever had formula. I think it was always bottled breast milk or actual breast. And she was quite particular about labeling and rotating of stock and all of that, you know. And she would write the date and time and anything she might have had. Like I would have written broccoli stir fry on my breast milk, but she would write 2 glasses of wine. And so, of course, when I was babysitting, I was always looking for the wine ones. Like, God, Mommy needs to take a little nap after you go to bed. Sorry, Jacob. I did it. I'm sorry. That's what I did. Jacob's godson. Anyways, you know, not to say that the 1 glass of wine she had with dinner 3 hours before she pumped that, the breast milk or whatever, necessarily would have been harmful. Obviously, if it was harmful, she would have pumped and dumped or just not drank the wine, you know. But sometimes it's not a bad thing, right? You have a little bit of a sip, if you will. So I was joking that I would look for the ones with the wine in it. You know, I got a good show I want to watch. This kid better go to sleep. Just kidding. Anyways, but some people can't control it, and if they are heavy drinkers, they should consider a different source of nutrition for their baby. Smoking, there's high nicotine levels in breast milk for smokers, and as I mentioned, specific medications necessary for mom's health might be contraindicated. The only medical condition a medical condition that's contraindicated with a newborn is galactosemia. They cannot have breast milk. They have to have very expensive formula. Very expensive. It's like $65 a can or something like that. By prescription only. Just like during pregnancy, do you need the medicine? Even if it's over the counter for a breastfeeding woman, you might want to tell them, avoid over-the-counter medications unless you have to have them, all right? People always ask, can I take this cold medicine? Well, do you need it? Do you really need it? I mean, a cold, I understand, will last about a week if it's untreated. If it's treated with like a Sudafed multi-symptom thing, it will last about 7 days. Know what I mean? So if you are having trouble breathing, then take a nasal decongestant or some sort of chest decongestant, right? But do you need all of those symptom management? Take the minimal amount or kind of medicine that you need, because the less you're giving to your baby medication-wise, the better. Whole bunch of different ways to watch your baby, to hold your baby. I think you guys were talking about this when you came back from your booby class, right? Cradle hold, football hold, which happens to be my favorite, particularly for beginning breastfeeding moms. The cross cradle hold, and then the sideline position. Latching on, my gosh, you'll be exposed to it in your clinical sites, and it's quite an art and a science to it all. And it's really important that the baby latches on properly. It will help with milk letdown. It will decrease the soreness of the nipples if the baby is latched on properly. And from what some of us have learned the other night, that nipple gets in their mouth quite deeply, like almost to the back of their mouth, into their throat. Like it gets pulled into there quite a bit. So we got to make sure it's in there properly. That's a jaundiced baby, isn't it? Huh. Anyways, all this. Oh, there's ways to, I mean, the baby, there's ways to assess the baby's latch, all right? We can see the ancillary muscles like around the temporal area, and we can see the jaw kind of gliding. You might hear a little, that's actually them swallowing. It doesn't sound like a big gulp like we would. You know, there's a way to kind of assess. It's called the latch score, actually, where this is the only thing we have initially with breastfeeding. So we do, every shift we want to assess how well the baby's latched on to their moms if they're breastfeeding. In terms of nipple care, if you didn't think you would ever hear that term in your day, here it is, nipple care. I repeat, nipple care. You want to air dry them as best as possible, toughen them up. We might use a hydrous lanolin cream, all right, to soothe any sore spots. I've seen pretty sore-looking boobies, all right? So we have to make sure they know they should maybe, if one side is more sore than the other, start on the side that's less sore because that's when they're hungriest and might be a little bit more vigorous. So start on the side that doesn't hurt so bad and then move to the side that's more sore. Again, air drying, squeezing out a little of breast milk and kind of putting it on there and letting it air dry is good. The lanolin is good. In terms of engorgement and whatnot, dry heat, letting them, some actually put like a low heat blow dryer if they want to air dry but they don't have time. You know, try to dry them off because that really helps in terms of, like I said, toughening up the nipples. Because the baby has such a strong suck, you need to break the suction before you try to pull that nipple out of their mouth because they will win that battle. And you do not want a nipple that long. Maybe you do. I'm not judging. I'm just saying it's going to hurt. So break the suction by putting your finger in the mouth, on the side of the baby's mouth, and break the suction before removing the nipple from their mouth. It's a supply-demand system, which I think is pretty cool, a demand-supply system. So if you demand breast milk every 2 to 3 hours, your breasts will, within 48 hours, supply breast milk every 2 to 4 hours, or whatever you're asking for it. All right? So the best thing you can do in terms of prevention or minimizing engorgement, meaning over full breasts, is nurse your baby every 2 to 3 hours. Nothing more, nothing less. All right? If the baby's not nursing well, demand milk every 2 to 3 hours. In other words, try to nurse the baby and then pump your breasts. So you're asking for milk every 2 to 3 hours. There's no reason to nurse well and then pump again because now you're asking for way more milk than you need. And once that milk comes in, it's going to come in twice as much as you want or that you need. All right? Do you see the difference between if you're nursing well, just nurse every 2 to 3 hours. If you're not nursing well, try and then pump. And that's pretty much all you need to do. Once you're engorged, because everyone has a little bit of engorgement when their milk comes in, sometimes some women will pump to kind of get the milk flowing and then get the baby on, just to kind of soften everything and get things moving. All right? A newborn baby will generally tell you when they're hungry, but not always. So you should wake your baby up, especially during the day. If you're trying to get on this nighttime is for sleeping concept, which is foreign to a lot of children, feed the baby. Wake the baby up every 2 to 3 hours and feed the baby every 2 to 3 hours during the day. And at night, you can go maybe every 3 to 4 hours, all right? But you might have to wake a newborn baby up in the middle of the night. Show of hands, who actually woke their babies up to feed them in the middle of the night? Yeah, unless the baby has a weight issue or, you know, a medical issue. I imagine you'd wake up for them. My baby slept through the night at like 6 weeks old. I woke up ready to explode, but happier than I've been in at least 6 weeks. I was like, oh my gosh. You know, yeah, there was no waking anybody up. No. Anyways. Cabbage. Did we talk about this last week at all? Yeah, no? Cabbage, while also looking like an attractive top, actually will help with swelling of engorgement. How does one figure that out?
You got desperate to try anything?
I don't know. Oh my gosh, my boobs hurt so bad walking through the cabbage patch. So distracted from the pain of engorgement that you trip and fall, landing on the cabbage, and immediately feeling quite a bit better. Maybe we should take this concept home to my breastfeeding friends. I don't know. But there it is. Cabbage helps. Read about it. It's the truth. I'm not just lying and making stuff up here to be funny. It's the truth. We just left wondering how they figured it out. Actually, I think it just has anti-inflammatory. I think you could use it like on other body parts as well for their but it just kind of fits around an engorged boob, right? It might fit around a knee just the same, but there it is. Yep, cabbage. Babies have growth spurts, just like older babies do too. So at the 3-week mark, the 6-week mark, the 3-month mark, the 6-month mark. Also, nursing's going really well. Everything's happening. We're on a nice schedule. Everything's good. All of a sudden, the baby is nursing like every hour or whatever. And mom at that point says, my gosh, I think my milk supply is decreasing. No, baby's going through a growth spurt and just needs more. So you might have to nurse every hour and a half or whatever for 2 days. That demand supply system kicks in, and you start making more milk per feeding for that baby, all right, until the next growth spurt. So that's that. Storing breast milk, thawing, reheating, all that. I'll basically just tell you it's the same as meat. You know what I mean? Keep it frozen until you need it. Don't refreeze after you've thawed it. You shouldn't microwave it. Those are all the pretty much standards for breast milk too. Although I would never want to compare breast milk to meat myself, but the rules are pretty much consistent. All right, bottle-fed babies certainly can wait a little bit longer because it's not about, they could bond with their mom without having to have the complication of feeding. Nutritionally, they don't need it right away. So let's just be skin to skin and enjoy mom. So we can wait a little bit until they start showing active hunger cues, hand to mouth, active bowel sounds, crying, rooting, sucking, all of this stuff. Do you know a newborn baby's stomach is only about a ½ ounce to an ounce capacity? All right, that's why we have those little bottles. There are 2 ounces in those little newborn bottles. They certainly don't need the whole 2 ounces. All right. ½ ounce to 1 ounce is a very good feeding for a newborn baby. In fact, 1 ounce might be too much for some babies. All right, the parents need to know that. They're trying to overfeed their babies, and the baby's just going to give back half the feeding. Okay, every 3 to 4 hours they should eat. We know formula comes in all different shapes and sizes, right? Ready to feed, powdered, and concentrated are the ones that I'm thinking of. At this point, I just need to remind everyone that not all people, your patients in particular, have the same comprehension level, reading comprehension level, all right? We cannot assume that your patient or their family members know how to follow directions. Can read directions, or just comprehend what the directions are saying. All right? So if they're bottle feeding, we need to make sure that they know how to safely prepare formula for their baby. And it has to be a conversation and a question and answer kind of thing. All right? So that they know. They need to know that it comes in 3 different forms. All right? They need to know how much powder you're supposed to mix with how much water and all of that. They need to know that there's a difference between ready to feed and concentrated. It seems to all of you smart college educated people that that's obvious, but it's not. If English is not my first language, I might not know what concentrated means, right? Because that's a word that I might just not recognize, all right? Babies have starved to death, nearly, with moms watering down ready-to-feed formula because they thought it was concentrated. Babies have been bound up tighter than tight with constipation from not diluting the concentrated formula. So neither is healthy for the baby. But it's just so important that our families truly understand and that we can verify their understanding of how to safely prepare formula.
So do you provide any formula for?
Oh, absolutely.
Hospital?
Absolutely. It depends on what hospital you're at. Formula is always available. Absolutely always available.
And for them to take home, like do you start a can and then you could write on the can and then?
We don't use canned formula. We use ready-to-feed bottles and disposable nipples. I will most likely restock the crib right before discharge with, a healthy amount of formula, and they're free to take whatever's in the crib. Basically, we're giving them. I didn't say that. Did not say that. The other people do that, not me. I forgot I was being recorded. No, it's always nice to have some on hand. A lot of my patients happen to be eligible for WIC, but they might not actually get to the WIC office of course, it's always the weekend when I'm taking care of them. So they might not be able to get to the WIC office until Monday to get whatever supply that they might be eligible for or whatever they have to do to get their benefits. So that's helpful too. Make sure there's no air in the nipple when you're feeding the baby. Get them to burp. Like I said before, you can lead a horse to water, but you can't make them drink. Well, sometimes it's really important that they do eat. If they're really, really sleepy, they might fall into that cycle where now they need to eat, and that's why they are sleepy. So, so we really need to get them. We're going to have to unwrap them, put some cool cloth on their face, provided their temperature is fine. Just piss them off a little bit, irritate them. I don't like to, but if I'm trying to wake them up and they're really out cold sleeping, I'll unwrap them and pick them up and let their feet dangle. Oh, they don't like that a bit. Oh, they don't like that. Oh, here's your mother. Whatever they have to do. Chapter 26. Chapter 26, okay? They got to learn all these things. I guess in terms of car seat safety, what is it like? They're like graduating high school before they get out of car seats these days, right?
Well, oh my goodness.
What is it?
I think they need to be at least 8 years old. They need to be at least 40 pounds.
8 years old? That's embarrassing. That's downright embarrassing.
Or the weight I think is higher.
Yeah, like the weight for big ones.
They just recently.
Wow.
It depends on how stuffed the car is. You're graduating today.
40 pounds you are. We didn't have car seats. My baby brother, there's a picture of my mom getting out of the car from us with a baby in each arm. Because, the twins. Picture her getting out of the car. My baby brother, because there were so many of us, I guess, slept, we had a car bed, but it wasn't attached to anything. It was just so that the baby, mom could drive without holding the baby. I guess she didn't trust any of us to hold the baby. Just laid on the back seat. All right, so I'm saying that's probably not safe, but 8-year-old, my gosh.
They're supposed to be in a 5-point harness until they're a minimum age 5, and now they legally in the state of Connecticut you have to stay rear facing until you're over 2 years old.
Rear facing for 2 years.
You'll get a ticket if you get pulled over with a forward facing.
Wow.
I hate that, because you know what, I locked myself out of a car with that rear facing car seat, didn't know what he was crying about, pulled over to the side of the road, gave him the bottle that fell, went back to open the door, locked out in winter. I was like,
So now your baby's inside.
baby's inside, I'm cold as hell, I'm outside,
All right.
car is locked, had to call the police, didn't have my phone, so I had to flag someone down.
Wow.
And he was like, well, we can't open the door. I said, I have a baby in the car. He's like,
I'll be right there.
open the door, all right.
Yeah. Wow.
You say that every time.
I did. And he said another time.
And then when they come out to get you, oh, I'm sorry. I thought I had a baby in the car. I'm really, really
Car seat
tired.
fooled me.
The cold got to me. That's funny. It's a good idea. I have a baby in the car. I mean, I have a baby seat in the car. You didn't hear that part. That's what I was saying. Even, it's just things have changed, and I get it. The 5-point harness, I get that. If you watch Crash, all you have to do is watch the crash test dummies to see why that's so important. Rear facing, I get that as well. My baby was in, I didn't have airbags in the front. And so she was rear facing, but she was in the front seat with me. We could do that then. Which was safer, you know why? Because I had not been looking at the road while I was driving. So, I don't know. There's all sorts of car seat safety things. We have certified car seat technicians who are technically the only ones legally able to physically handle the baby in the car seat. Because if you are not certified car seat technician, you could be liable for any damage that occurs. Hospitals, I think we've gone too far. We can do basic stuff. We can say, put your baby in. Yep. Okay, so lift up that plastic clip, should be up at the nipple line. All right, you shouldn't be able to put more than 2 fingers between the strap and the baby. Okay, yep. Okay, do that, but you're not actually supposed to touch the baby. Because if you're not a certified car seat technician, you're basically practicing out of your scope. Isn't that kind of ridiculous?
Yes.
Yeah. Well, I'll get right in. And I'm sorry about this. I should turn the recording off. When I walk my patients out to the car, if they have their base is, I love when their base is already installed in there. I'll ask them, did somebody install this for you? Or no, I put it on, and I'll check it. And I was a certified car seat technician back in my prime. So I will get down and I will press on the base and tighten the seatbelt. You're like, whoa. And sometimes I've tightened it like this much because of the weight, the push of the seat and everything. I said, now it's set. And they're like, wow. You know what I mean? That's against the rules these days, or against the hospital rules. It doesn't mean that it's against the rule to help a new parent out, but it is, it's all about liability. Isn't that sad? But that's how important car seat safety is, you know? The only other thing I'll say about car seats is that if a car seat is involved in an accident, even if there's no baby in the car seat at the time, you're supposed to replace the car seat completely because of anything could have been damaged within.
I just have to write a letter for a mom to prove to the insurance company to get that done, but there's new rules now that it has to be a more extensive type of collision to get it replaced.
Over a certain speed and stuff.
Yeah,
Well, there's-
it's a minor, you have to meet certain criteria.
Mm-hmm.
So our proof was that got whiplash, so we write a letter for the insurance company to get it covered.
Wow.
There's like a list of things that you have to, if there's one thing in that list that you make, like you have to be clear of all those things on the list. We got T-boned like 3 weeks ago and I had to go through it.
Darn it.
So like, we had to replace the car seats because it didn't clear all of that criteria.
Wow. Did insurance cover the covering of your car seats?
Well, I mean, we're suing the guy that did it.
Uh-huh.
So we paid it out of pocket, but they're reimbursing us.
Yeah. Yeah, you're not going to wait for insurance
I'm not
coverage,
gonna
yeah.
for that, no.
But as long as you save your receipt,
Oh, yeah.
car seats are expensive.
Oh, yeah.
I mean, they were expensive in my day, but gosh, if I had to to keep 8 years worth of them. Oh, that's something. Now, you'll see babies, especially as winter is approaching, you see all the bundled up. They have all the puffy coats and all the inserts and everything. Well, the more puff, the less safe, all right? Because in a crash, all that puff gets flattened. And if you have a baby nice and tight in the car seat with all the puff, flatten all that puff, and you got a whole lot of extra room for that baby to just come flying out. So, there's plenty you can say as long as you don't touch the car seat. Anyways, for those in the pediatric world or in the newborn world, fire stations, police stations, lots of certified car seat technicians. It's something I think that it's a valuable thing. Rules and models of car seats change to the point where it's something you have to keep up. Lots of education, lots of literature reviews and stuff, just simply to remain current. But it's a big deal. They need to know that their entire environment is safe and the different things that might come up. Crib safety is another huge one. All right. All those pretty crib layettes or whatever you call them, the blankets and the pillows and the matching bumpers and the nice little, all these stuffed animals and everything. None of it's safe. Thanks for playing, folks, but take it out. The mobile, they can't see that far away anyway, so wait till they're older and then it becomes a choking hazard. But anyways, blankets should be minimized. Pillows are completely outlawed. So I don't know how old. How old did you start giving your baby a pillow? 2? Yeah, they don't need pillows, right? They want good airflow, so the bumpers are even considered not that safe either. The slats, all the heirloom cribs we got from 5 generations ago, completely unsafe, filled with lead paint and the wrong spacing of the bars, the crib bars, all sorts of things, that you need to consider. Yeah. Babies should be on their backs to sleep, all right? Not on their bellies, on their backs. When to call the doctor, that's important. As I mentioned before, crying happens because they need something, all right? There are quieting techniques, swaddling, the close skin contact, pacifiers, sucking, rhythmic noises, movement, placing the baby on their belly as long as they're being observed, and magic. But they should be on their backs to sleep. Newborn babies sleep 16 to 19 hours a day. All right? If we can try teaching them that nighttime is for sleeping, if that's your world, making sure that, where they are sleeping is dark and quiet and cool. My baby stayed in her bassinet in my room for at least 3 months, I think, after she was born, maybe even longer, I don't know. When they are on their belly, when they are awake and supervised, you can give them tummy time or whatever you new moms call it. I don't know what we called it then, but to help promote muscle development and all of that stuff, so that their head didn't get flat in the back. My baby did have that bald spot right across a little bit. All the different ways to hold a baby. Colic hold happens to be one of my favorite holds. That's where you have the baby on their belly on your forearm. You're supporting their head up in the crook of your elbow, and their like pelvis or whatever with your hands, so their legs are kind of hanging off, and their head is up here. And just the gentle counter pressure of your forearm on their belly, and just the fact that they're turned over helps. That's why they call it the colic hold, because if they're really gassy, that might help get the gas out. In terms of bathing, the only thing I'll say about that is that we don't recommend full immersion baths until the umbilical cord falls off. If the point of the umbilical cord is to dry up and fall off, why not maybe avoid soaking it, right? Probably, I'm not sure it necessarily matters, but let's just get used to handling your baby, and then you could, after 2 weeks, get that said baby wet and slippery. You know what I mean? I think that's a pretty good, reasonable expectation. Comfort level with baby, holding baby, then let baby get wet and slippery. All those pretty lotions, the smell, you know what a baby smell? It's all artificial perfumes and dyes. Don't do it. They do not need lotion. They do not need powder by any means. They really don't need powder. Occasionally, a baby might need some diaper cream or something if they have irritation. Vaseline is what we might use initially on their down belows. But there's not a whole lot they need other than just a sensitive skin soap and a bath every couple of days. You don't need to give a newborn baby a full head-to-toe bath with shampoo every day. You're going to dry out and irritate that sensitive, fragile skin. All right? I say do a top and tail every day and leave the full bath 2 to 3 times a week. You know, the whole feeding thing, before you know it, you're getting to know your own baby and their routine, but just keeping these things in mind for babies and passing that on to the parents. As I mentioned, cord care is now just watching for signs of infection and keeping it open to air from the diaper. Circumcision is a personal choice. You have as many people against it as are for it, with the arguments in kind. We're not going to do it, as I mentioned, with a hypospadias or an epispadias, which is the opposite of hypospadias. There is something else to consider, and that's the vitamin K, right? So we want to wait at least till 24 hours has passed so that the vitamin K has worked, has kicked in and started working for blood clotting, all right? Circumcisions, while we might have made it more comfortable, does disrupt feeding, so we would like breastfeeding to have been established. So then before we give them the stress of a minor procedure. You can go through, this is the Plastibell, this is the Gomco. This is probably the most, between this one and there's another called Mogan clamp. Those are the 2 most common clamps. I think they were invented and began using them in the medieval times. I don't see that they've changed at all, at least in 30 years, at all. The Plastibell is newer, and that's still 20, 25 years old, as far as I know, maybe even older. But these clamps really do look barbaric and ancient. That's the Mogan. Yeah. What it's supposed to do is provide hemostasis, so we're squeezing off the blood supply to the foreskin. In doing so, some doctors, and I've seen it, also, if you kept it on there the right amount of time, it will minimize bleeding, and it will actually cut off the feeling. This is 2 good reasons. This one here, this extra piece goes on to protect the gland, so you're not cutting anything that you're not supposed to cut, all right? Then you put this other thing on there, tightens it up just between this thing and the outside, and then wait for 2 minutes or whatever, and then trim it off. Good times, right? Does anyone want to watch a video of that, or are we good?
Yeah, we're good.
All right, then. We'll watch one tomorrow. Right, Peter? Hmm? Yeah, enough about circumcisions. Blah, 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 blah. Again, all the things they need to know. It's important. If we're doing it along the way, they will have an ability to ask questions, ask again, demonstrate back to you that they are familiar with this and that, all that. Are we done? Hmm.
Right on time. 10
Right on.
seconds.
Oh, cool.
10 seconds.
Yeah. Wow, that's cool. Oops.
Here's the